Hi guys, in today's video we are going to talk about nursing process. What is nursing process? It is a systematic, patient-centered method used by nurses to provide high quality care to patients. We're saying now are systematic, patient-centered and high quality care. Systematic in the sense that it uses a step-by-step process. Patient-centered in the sense it is individualized. This nursing process is done per patient. With this step-by-step process, patient gets to have a quality care. The next definition is it is a problem-solving approach that ensures effective decision making and individualized patient care. We have 5 steps of nursing process. You can remember it with ARPI. A stands for assessment, D stands for diagnosis, P stands for planning, I stands for implementation, E stands for evaluation. In assessment now, it's just all about gathering, collection and analyzing of patient data. Here now, we are going to gather both subjective and objective data of the patient. Subjective data are the things the patient told you. I'm feeling pain, or I'm feeling dizzy, I don't have strength. But objective data are those things you measure, or those measurements you got from laboratory investigation, like via vital signs. You check the temperature, you check the pulse, or you use pain scale. All these are objective data or lab results. Blood sugar level, for example, a patient's medical diagnosis is puerperal sepsis. So here now, the patient will now tell you, I'm having pain, having itching, and you check the patient's temperature and you got 40 degrees Celsius. So that takes us to the second one, which is diagnosis. Diagnosis now is identifying actual or potential health problem based on assessments. This patient's medical diagnosis is puerperal sepsis. She now told you everything she's going through, and you now check the vital signs. So now you are now going to diagnose her. Since you got 40 degrees Celsius, the nursing diagnosis now is hyperthermia. So the second one now is planning. You set measurable goals, determine appropriate nursing intervention. This patient has hyperthermia. This planning now, it is where you are going to tell us what you are going to do. Measurable goals to stop this hyperthermia. I'm going to depit point the patient. I'm going to remove excess clothing. I'm going to on the fan. I'm going to open the windows and the door. And you get, that is the planning. In implementation, you now carry out what you say you are going to do. E, which is evaluation, now is assessment of the effectiveness of this nursing intervention and adjusting it if necessary. Maybe you've done everything, you've carried out all the nursing intervention and none seems to work. Maybe you now resort to, okay, let me give this patient antibiotic drug. You get, you people might be saying, is outcome identification not part of this nursing process? Yes, it is, but it has been joined with planning. But other school of thought, but for the sake of this class, we're going to define what outcome identification is. Outcome identification is defining expected patient outcome. This outcome identification is just like objective in nursing care plan. My patient's temperature will reduce, like what you want to achieve. This is outcome identification. So when planning now, when writing your plan, when saying I'm going to do this thing, I'm going to do that, your plan must be smart. Plan must be smart. S stands for specific. Clearly defines what will be achieved. You have to clearly define what you will achieve. You will say that my patient temperature will be reduced. You are specific that is going to reduce. Secondly, it must be measurable. It can be quantified or observed, in the sense that you are going to say Mrs. AU's temperature will reduce by 0.5 to 1 degree Celsius. You get? For A stands for achievable, that is realistic given patient's condition. A patient that is obese, and you are trying to lose weight for the patient, you cannot say that the patient will reduce by 10 kg or 20 kg in 2 days of nursing intervention. It is not possible. It's not achievable. It's not realistic. Or you say that the patient's temperature will reduce by 3 degrees or 4 degrees Celsius in 10 minutes or in 5 minutes. It's not achievable. So your plan must be achievable. It must be realistic. And R now is relevant. It must align with patient's needs and diagnosis. Like this patient with hyperthermia, you cannot say that I'm going to put the patient in radiant warmer, close the window. Did not align with patient's diagnosis. So your plan must align with your nursing diagnosis and what the patient is presenting. C now is time bound. You must have a clear deadline for achievement. You will now say Mrs. AU's temperature will reduce by 0.5 to 1 degree Celsius in 15 to 30 minutes of nursing management. It is time bound. You are going to tell us how long you will be able to achieve what you want to achieve. So this is everything about nursing process. And next video will be on nursing care plan. And if you are a student nurse watching me, haven't followed me, what are you waiting for? Because in my next video, we are going to break down nursing care plan, and we will do some practical on how to draw nursing care plan after we've already learned everything about nursing care plan. So do well to like, share, comment, and I'll see you in my next video.